It was a night like any other, long, chaotic, loud, typical for the emergency department. We were short-staffed again, and patients kept rolling in. Chest pain, sepsis, road traffic accidents, everything at once. I'd already missed my meal break and had been running on caffeine and adrenaline for hours. Around 2 a.m., I was assigned to a new admission. Mr. Robert, 67 years old, altered sensorium, known hypertensive, confused but stable. The junior doctor scribbled the orders quickly. I took the prescription slip, glanced at it, and headed straight to the medication room. That's where the moment happened. The drug written was injection labetalol, IVA medication we use to lower blood pressure in emergencies. I pulled it from the shelf, drew it up, ready to push, but something didn't feel right. Mr. Roberts' blood pressure, I remembered, was already borderline low 110/70ths. Why would he be getting injection labet? I froze, my hand holding the syringe, my mind replaying the last set of vitals. I went back to the notes, looked at the prescription again. It was messy, sloppy handwriting, not labetalol. It was meant to be lactulose oral syrup for hepatic encephalopathy. My heart dropped. If I had given that for medication, I might have caused severe hypotension, maybe even cardiac arrest, on a man who was confused but stable. I walked over to the doctor, showed him the note. He squinted, shocked. "Oh my God, that's my bad," he whispered. We both sat there for a second, just breathing. I was this close, 1 second away from a mistake that could have killed someone. Not because I didn't know what I was doing, but because I was rushed, tired, operating on autopilot, like so many of us do in the middle of a night shift. I didn't give the wrong drug, but I could have. That night changed the way I nursed. Now, I double-check everything. Not just the drug name, the vitals, the condition, the why behind every order. Because it's not just about following instructions, it's about understanding the patient and catching the slips before they become tragedies. Learning lessons for healthcare workers. 1. Never administer a medication you're unsure about. If it's prescribed, clarify, ask, reassess. 2. Fatigue increases risk. If you're feeling foggy, take a pause, not a shortcut. 3. Trust your clinical judgment. Nurses are not just drug dispensers, we're the last line of defense. Learning lessons for medical and nursing students. 1. Learn to read messy handwriting, but more importantly, learn to question it. 2. Don't be afraid to clarify an order. It's not insubordination, it's patient safety. 3. Cross-check medication with patient vitals, history, and diagnosis. Context matters. Learning lessons for the public. 1. Nurses and doctors work under pressure most can't imagine, but even a second's error can have consequences. 2. Support policies that allow safe nurse-to-patient ratios, proper rest, and accountability. 3. Medical professionals are human. Systems and safety checks save lives. Closing reflection. Sometimes the difference between life and death isn't a surgery or a miracle drug, it's a pause, a moment of doubt, a second look at messy handwriting on a night when exhaustion blurs your vision. That night, I realized patient safety doesn't just depend on treatment, it depends on vigilance. In a world where seconds matter, slowing down can save a life. This is Silent Scrubs, where every story carries a lesson for healthcare workers, students, and the public. If this story spoke to you, subscribe and join me as we continue uncovering the unseen truths of hospital life.